Hi, this is Dr. Josh Yamamoto, and on September 29th, we recognize World Heart Health Day, where the whole world is supposed to take a moment and consider the health of our hearts. So, in light of that, I figured it would be useful to have a little discussion on what exactly is heart disease anyway, because there seems to be a certain amount of vagueness and confusion about that. Again, welcome to the Foxhall Wellness Channel. This is brought to you by the Foxhall Foundation. Please check out our website and take a look at all the other videos we have posted on YouTube. So, one of the major messages we want to get across to everyone is that good health doesn't just happen. We have to build it. We have to build it as we age. It's not just a matter of chance or luck. It's an active, interactive process. So, heart disease. Heart disease, even in this day and age, remains the #1 cause of death in the world. And so if that's the case, let's ask, well, what exactly is heart disease anyway? In the old ancient times, diseases in general, and heart disease in particular, was defined by symptoms, but defined by what people experienced. So 400 BC or thereabouts, Hippocrates said, "He who would make accurate forecasts as to those who will recover and those who will die must understand all the symptoms thoroughly and be able to appreciate them." Sounds pretty wise. The point is, if you have advanced disease, your symptoms are going to tell us a lot about your outcome or your prognosis. Once an organ is failing, understanding how that manifests can tell us what's going to happen. But you know what? In 2021, we don't like to wait for symptoms to tell us something is failing to predict the risk of what's going to happen. Symptoms in today's world are not what predict risks. Knowing about a disease burden, knowing about a process, looking on the inside predicts risks. We don't feel things changing in the process of changing until after something bad has happened. So we no longer define our diseases just by the symptoms. Okay, well, Hippocrates certainly defined heart disease by symptoms. If we're not going to do that, well, what exactly is heart disease? Let's say heart disease is any time or any circumstance or any condition where your heart doesn't work normally, or doesn't work as well for you or as efficiently as you need or want it to. So, pretty general terms. So saying we have heart disease is like saying, if I have a car, it's got engine trouble. If our body is the car, our car needs to run, we need that motor, we need the engine to work. If the engine's not working, we have engine trouble. Our human body needs to run, it needs to work. Our heart is the heart of the body, I suppose, so we need it to work. So having heart disease is like saying we have engine trouble. And so what we really need to do is know why an engine's not working. We don't want to wait for our car to break down and be stuck on the side of the road before we start asking, how do we keep this healthy? What is our maintenance? You can see there's a lot of different parts to a motor. All of these different things can go wrong. We can have valve trouble, electrical trouble, transmission trouble, fuel line troubles. There's a lot of different things that can go wrong with a car's motor. Likewise, thinking of your heart, it's not one thing. Heart disease is not one thing. And so we need to stop thinking of it that way. Oh, heart disease, it's just one thing. Nope. Heart disease is about the process. What is the process that's going to make our heart not work right for us? What is the process that will affect the heart or lead to the heart being less efficient or damaged? Okay, what were the processes? In ancient times, in the days of Hippocrates and even before that, the process that mainly affected the heart was rheumatic fever. Okay, rheumatic fever is a childhood illness like strep throat that caused an inflammatory response that tended to beat up, chew up, damage our heart valves. And the valves inside the heart, if they're damaged, the heart's not going to work right. This is going to lead the heart to fail. So heart disease used to be rheumatic fever, but along came penicillin, which dwarfs Hippocrates. The point is, penicillin treats these infections that used to lead to heart disease. So from the dawn of our race species to the mid-20th century, if we said someone had heart disease, Mostly that meant they had rheumatic heart disease, which again is a post-infection damage to the heart. Okay. Second half of the 20th century, not so much. People really got all concerned about chest pain, which was called angina. Angina was a term coined in the 1700s, meaning a squeezing of the breast. People used to think this squeezing pain had to do with the breast muscle. And then it became recognized that the squeezing pain was related somehow to the heart. So angina became heart disease of the latter part of the 20th century. And it wasn't really until the 1980s that we figured out what was going on. What was going on were that arteries filled with plaque and clot. So plaque and clot in arteries, particularly the arteries that feed the heart muscle, are what we call coronary artery disease. If you clot off an artery, you're going to cut off the blood flow. If you cut off the blood flow to the heart, well, that's a heart attack. That causes heart damage. You can get killed suddenly from a heart attack, or you can have it happen in small bits over time and just damage your heart, which can lead to heart failure. So heart disease in the second half of the 20th century was really coronary artery disease, plaque and clots. Arterial vascular disease, the abnormality, the aging, the plaque and clot in arteries, lots of names. Coronary artery disease, atherosclerotic vascular disease, ischemic heart disease. The word ischemia means you're not getting enough blood someplace. All that is really the same thing. And that's what heart disease was after the age of penicillin. Well, there's more things that can damage your heart than the lack of penicillin and having strep throat or a blocked artery. What else? Well, high blood pressure. As we get older, arteries get stiffer. Stiffer pipes mean higher pressure. Higher pressure can overwork the heart, even if your arteries are actually not full of plaque or clot, and certainly if you never had rheumatic fever. And a very important thing in this day and age is slowing or irregularity of your heart. If your heart beats too slow, every single heartbeat has to do so much work that can actually overwork your heart as well. That also leads to the irregularity, which we call atrial fibrillation. So what else can affect the heart? What are the processes beyond just arterial disease or rheumatic fever? Hypertensive disease is high blood pressure, or conduction disease, the slow or irregular heart. Sinus node dysfunction, meaning a slow heart, and atrial fibrillation, which follows after that, the irregular heartbeat. There are other things that can damage your heart. Irregular valves, you can still have irregular valves for reasons that are not related to rheumatic fever. They can wear out. And there are some things that can directly affect the heart muscle itself. They're much, much less common, and that is a little bit more involved in how to help a heart with that. And there are kids born with abnormal hearts, what we call congenital abnormalities, which are generally fairly rare. So, what are the processes that affect a heart? This will tell us what is heart disease. Number 1, arterial disease. Number 2, hypertensive disease. And number 3, conduction disease. Those are the big 3 that really account for almost all of the adult heart disease that we see today. And you know what? All 3 of these are actually part of the natural aging process. 100,000 heartbeats a day, wear and tear, beats up arteries. The natural healing process leads to plaque. That's arterial disease. Everybody's arteries stiffen, we lose flexibility, that raises pressure, that leads to hypertensive disease. And everybody's natural timekeeper or pacemaker ages over time, which leads to a slower heart, and that's a major factor in encouraging the irregularity of atrial fibrillation. All of those things are part of the natural aging process, which is why we often point out there is almost, emphasize almost, no such thing as heart disease. It's really just natural aging. But that's like saying the leading cause of death in the world is old age. You know what? That's true, and that's not necessarily bad, but old age is cardiovascular aging. Now, remember, there are other things that can affect the heart, which is why cardiologists still have things to do. Valvular heart disease, what we call myocardial disease, things that affect the heart muscle directly, and the congenital stuff. So, old school, in the old days, we defined everything by symptoms. Heart disease was defined by symptoms. The word murmur means the sound of a heart, which used to terrify generations in the 1930s and 40s because people were afraid that their kids had gotten rheumatic fever. And now we call angina, oh my gosh, I have chest pain. You know what? Chest pain doesn't tell you if you're going to live or die. What tells you if you're going to live or die is the health and safety and the blood flow of your heart, which are all things you need to work with your doctor to know. Old school, we defined heart disease by symptoms. 2021, we define heart disease by the process. Do you have arterial changes? Do you have excess blood pressure overworking the heart? Is your heart being too irregular, causing it to not let blood flow normally? Old school, new school. In the new school, we think of the process. So, a few things to remember. Everybody ages. None of us are immune from aging. If you don't want to die of old age, then I guess you die young. So we kind of want to die of old age, but we want to manage this. Everybody ages and will have vascular changes. Everybody is going to have the stiffening arteries and has the potential for high blood pressure or hypertensive changes. And everybody, if you age long enough, you're going to have some slowing and potentially some significant irregularity of your heartbeat. It's all part of the natural aging process. That's what heart disease is in the 21st century. You need to know that we don't really know our heart's health on the inside unless we look. We love to say heart disease is a silent killer, but it is not invisible. You can look to know what your heart's health is. Symptoms, which define disease in the days of Hippocrates, does not define disease, nor does it predict risk today. Okay? Disease burden and progression. Nobody feels plaque growing until it hurts you, but you can see plaque growing. If you have a lot of plaque and if it's actively growing, you can see that. That predicts risk. That also tells us what we can do. Irregular heartbeats. Most people don't feel them at first, yet if you have irregular heartbeats, you're not going to have normal blood flow, and that can cause all sorts of damage and problems, but you can see it if you look. You need to know the process. You don't cure aging, you manage it. You know the process and you manage the process. Good health doesn't just happen, you have to build it. Said that, remember that. So everything that I just mentioned you could actually find in our book, which you can get anywhere better books are sold online, which means Amazon, but that's fine. You can prevent a stroke because it's all about managing the natural aging process. So remember, this year on National Heart Health Day or Heart Day, say to yourself, gosh, I don't want heart disease, but I am going to age. I'm going to understand the process. I'm going to understand that I can build better health. So watch This Week in Medicine every week. Find out more, and it was great to talk to you again.